This is part of a crash course series I created about a year ago. And I think as we get new caregivers into our program, it's good to revisit some of these topics so that way, everybody has an opportunity to learn as they go. So before I do get into it, though, I want to let everyone know that I am a therapist. I'm a social worker. I'm not a medical professional. So the information I have received from the American Stroke Association. You can go online on the website. They have a lot of really great information. I just kind of got the highlights. And if you have any specific medical questions or anything specific to your situation, I would encourage you to reach out to your primary care physician and get those specific answers. But if you do have questions about the information I presented today, I will answer those as best as I can afterward. But again, I'm not a medical professional, and this is solely for educational purposes only. I'm not trying to treat or diagnose any conditions, okay? So our agenda for today, we're going to just define what a stroke is. We're going to talk about some of the risk factors, the signs and types of strokes, and some of the effects of a stroke. We're going to briefly talk about treatment and rehabilitation, and then I'm going to give you some caregiver tips and some resources that you hopefully will find useful. And of course, these are recorded, so if you guys want to go back and watch it or share it with a friend or a loved one, it will be available on our website and on our YouTube channel, typically early next week, okay? So what is a stroke? Stroke is the disease that affects the arteries that lead to the brain and are within the brain. It is the number 5 cause of death and the leading cause of disability in the United States. So this is definitely something that impacts all of us to some degree, right? Whether we are caring for someone who has a stroke, who has experienced stroke, if we ourselves maybe experience stroke, or if we know people within our circle, it is a very prevalent occurrence, okay? And stroke occurs when a blood vessel that carries oxygen and nutrients to the brain, it gets blocked by a clot, or it can burst or a rupture. And so when that happens, of course, part of the brain can't get the blood and the oxygen that it needs, and so the brain cells start to die. The good news is, though, up to 80% of strokes may be prevented, okay? So there are some ways that we can make sure we manage our health and our stress levels to prevent strokes. And I hope that you stick around to the end of that and you get some of those tips. So what are the risk factors? Okay, so some risk factors we can control, but there are some risk factors that we cannot control, okay? So the first one is age. Of course, we cannot determine how old we are. We didn't, sign a release form when we were, being born to say this is the time that I want to be born. But the likelihood of having a stroke increases as we age, okay? So stroke is more common among the elderly, but many people under 65 also have strokes, okay? Even babies and children can have a stroke. And so if you have a family history of stroke, that obviously cannot be something that you control, right? So if your parents, your grandparents, your brother or sister has a stroke, especially if it's before the age of 65, you may be at a greater risk, okay? Sometimes strokes are caused by genetic disorders. Next, race. So African American people have a much higher risk of death from a stroke than white Americans do. Mostly because of societal barriers and systems that have harmed their health for decades. Black Americans have a higher risk of high blood pressure, diabetes, and obesity. So for some Hispanic people, the limited availability of Spanish language health information may hinder efforts to prevent strokes just because, we can't communicate in their language. They're not going to understand what we're saying. Another one is the biological sex, okay? So if you have a female body, you have more strokes than those who have male bodies, okay? Women tend to live longer than men and are older when they have a stroke, okay? Several factors can increase strokes risk for women, including pregnancy. If there's a history of preeclampsia or eclampsia, if there's a history of gestational diabetes, taking oral contraceptives, especially if you smoke while you take birth control, that can increase your risk of stroke. Also, any postmenopausal hormone therapy can increase your risk, and changes in hormonal status can increase your risk, okay? Some stroke factors that seem to be stronger or occur more often in female bodies, migraine with aura. So if you have migraine disorder, you know what that means. And I believe it's the kind of like what's the word I'm looking for? It's not pain, but it's kind of like a pressure you can kind of feel. Atrial fibrillation, diabetes, hypertension, depression increases your risk of stroke if you have a female body, and psychosocial stress, okay? Another thing that you can't control is prior stroke or heart attack. So if you've had one stroke or if you've had a heart attack, it does increase your risk factors for subsequent strokes. Now onto the risk factors that you can control. So remember I said earlier, up to 80% of strokes can be avoidable. This is how we avoid that, okay? If you have high blood pressure, this increases your risk of stroke, okay? Nearly half of American adults have high blood pressure, okay, or hypertension. High blood pressure is a leading cause of stroke and the most significant controllable risk, okay? So if you have high blood pressure, please get in contact with your primary care physician if you have not done so already, and find out ways to reduce your blood pressure to mitigate the effects of that so that you lower your risk of stroke, okay? Next, if you're a smoker, nicotine and carbon monoxide in cigarette smoke damages your heart, okay? It damages your blood vessels. This makes you more susceptible to stroke because if you remember, a stroke is where there's a blockage in those blood vessels. So if you're consuming nicotine and carbon monoxide by smoking, that restricts your blood vessels even further, okay? So that's going to make it even more difficult for blood and nutrients to get to the brain like it's supposed to. According to a nationwide analysis of stroke survivors in the US, almost 60% of them had a history of smoking. Okay, so that's more than half. Next, if you have diabetes, so this is type 1 or type 2 diabetes, it's very important to control your blood sugar. I'm sure your doctors, if you have this diagnosis, tell you this all the time. Diabetes mellitus is an independent risk factor for stroke. So many people with diabetes, they are overweight, they have high blood pressure, they have high blood cholesterol, and all of this increases your risk, okay? We do know, obviously, diabetes is treatable, but the presence of the disease still increases your risk of stroke, okay? So if you have medications, if you have things that your doctor wants you to do to reduce your blood sugar, take that in consideration, okay? It's not just diabetes you have to worry about, but it's the increased risk for stroke if you do not control your diabetes, okay? Next, your diet. We can all control our diet, at least for the most part. Diets in high saturated fat, trans fat, cholesterol, all of this raises your blood cholesterol levels, okay? And those high blood cholesterol levels, they contribute to blockages within those blood vessels, okay? High diets in high sodium or salt can increase blood pressure, excuse me. And those with high calories can also lead to obesity, okay? But a diet containing 5 or more servings of fruit and vegetables per day may reduce risk of stroke, okay? So just be mindful of how are we fueling our bodies and long-term effects of that over time. Next, obesity. So excess body weight and obesity are linked to an increased risk of high blood pressure, diabetes, heart disease, and stroke, okay? Even if you just lose as little as 5 to 10 pounds, that can significantly affect your risk. And if weight control has been a lifelong challenge, you can take small steps today to manage your weight and lower your risk. No one's asking you to wake up in the morning and say, I have to drop 100 pounds or I'm going to have a stroke, okay? You can take little steps towards that goal. You can just do a 5 or 10 pound loss, and that can, even just that little amount can really decrease your risk for stroke, okay? Next, physical inactivity, which I know some of you are never sitting down because you're always up having to do for your loved one. People like me, I work in an office, so I'm usually sedentary most of the day, so I have to be mindful about getting that physical activity in when I'm off the clock. But that physical inactivity, that does increase your risk of stroke. It increases your risk of heart disease. It increases your risk of being overweight or obese, right? High blood pressure, high blood cholesterol, diabetes. So all of that stuff is the risks are increased just by being physically inactive. So if your doctor tells you, well, hey, maybe you should start walking a little bit more, maybe you should start, doing a little bit of exercise here and there. Nobody's asking you to completely overhaul your life and your world, but making tiny, tiny changes over time can decrease your risk of stroke. Okay. High cholesterol. So we can control the amount of cholesterol in our diets. Okay. Some of you may be like me, where you just have high cholesterol because of hereditary reasons. Your body doesn't process it. But for most of us, the high cholesterol is directly correlated to our diet. Okay, so we can control that. Cholesterol is a fat-like substance that is in our blood. And so if we have high cholesterol, that increases the risk of blocked arteries. Okay, and if an artery leading to the brain becomes blocked, that can result in stroke. Okay. And then finally, sleep apnea. So more than half of the people who have had a stroke also have sleep apnea. So if you have sleep apnea and your doctor has prescribed devices for sleep or things for monitoring that, and you are neglecting that care for yourself, I highly encourage you to follow your doctor's orders because it can prevent the risk of stroke, or can decrease your risk of stroke over time. Okay. So now that we've gotten through the risks of stroke, let's talk about the signs of a stroke, okay? So there's this nice little acronym here, FAST, F-A-S-T, and we can use that to spot a stroke, okay? So F, of course, stands for face drooping. Most people know that if somebody's got kind of like a muscle looseness suddenly on one side of the face, that's an indication of stroke. So we just want to ask, does one side of the face droop or is it numb? Ask the person to smile, and if their smile is uneven, that could be a sign of a stroke, okay? Next is A, arm weakness. Is one arm weak or numb? Ask the person to raise both their arms and see if one arm drifts downward, okay? Speech difficulty, that's what S stands for. Are their words slurred, right? Are they having a hard time enunciating? And of course, some of your loved ones have slurred speech already because of their condition or their age or what have you. We're talking about this is like a sudden onset, okay? And then T, time to call 911. So if you notice the face drooping, if you notice the arm weakness, if you notice the speech difficulty, call 911, okay? Strokes are emergencies. Every minute counts, okay? So we want to call 911 immediately, and we want to be mindful of the time that the symptoms first appeared, okay? Some other stroke symptoms. We want to watch for sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, because typically when there's a blockage on one side or in the brain, it's going to affect. So if you have a blockage on your left side, it's going to impact your right side. Okay. And we'll get into that a little bit more later. Next, is there confusion, right? Trouble speaking or understanding speech. Again, this is going to be what's different from the norm. Okay. Is there going to be trouble seeing in one or both eyes? Do they have blurred vision? Has it kind of whited out? Are they having trouble walking? So are they dizzy? Have they lost their balance or coordination? Are they having severe headaches with no known cause? Okay, so the FAST is a great acronym, but then there's also the numbness, the confusion, the headache, trouble walking. Okay, those can also be signs of stroke. All right, now we're going to spend a little bit of time on the types of stroke, okay? And I will go ahead and apologize now if I butcher these words, but again, this is not my wheelhouse. I'm not a medical professional, so I'm just using my phonetic skills here. But there is there's three different kinds of stroke, okay? So there's an ischemic stroke, and this occurs when a vessel supplying blood to the brain is obstructed. So it's going to be like a clot in the brain. And this is going to be the majority of strokes are going to be one of these kind of strokes. Okay, this is going to be 87% of all strokes are going to be ischemic strokes or caused by clots. Next is a hemorrhagic stroke. This is a brain bleed. And so this happens when you have weakened blood vessels and that ruptures and that blood goes into the surrounding brain, okay? And the blood accumulates and it causes pressure or compression surrounding the brain tissue. And that's what causes the cells to die off, okay? And this will be about 13% of the stroke cases, okay? And the last one is called a TIA, a transient ischemic attack. So this is temporary blockage of blood flow to the brain. And this, the clots usually will dissolve on its own or it'll get dislodged and kind of pass through. And these symptoms will usually last less than 5 minutes. And so when a TIA doesn't necessarily cause permanent damage, it's a warning stroke. Okay, so this is kind of like your indicator that, you know, a quote unquote real stroke is somewhere down the line. Okay, so this is a warning signal for you. So if you notice those symptoms, you want to get help immediately, even if the symptoms go away. Okay, you want to get that full workup, get that on your file that you've had one of these, and then ask your doctor what preventative measures you can take to lessen the risk of having one of these other types of strokes in your future, okay? Or your loved one's future. So the effects of a stroke. So if a stroke occurs and blood flow cannot reach the region that controls a particular body function, that part of the body won't work like it's supposed to, okay? So how you're impacted by a stroke depends really on the location and the extent of the damage to the brain tissue. So because nearly all of the signals from the brain to the body are that vice versa cross over on their way to and from the brain, that means that one side of the, you know, the effects of the stroke is going to occur on the opposite side of the body, depending on the side of the brain, okay? So a stroke on the left side of the brain affects the right side of the body, and a stroke on the right side of the brain affects the left side of the body. But if the stroke occurs towards the back of the brain, it's likely that there's going to be some disability involving in your vision, okay? So here's a few of the symptoms of, or some of the effects of a stroke, okay? So on the left side of the brain, the right side will usually be affected by experiencing paralysis on the right side of the body, sensory changes, speech and language problems. It can affect your abstract thinking, problems with thinking and memory, and then a slow, cautious behavioral style. Okay, so this is if you have a left side of the brain stroke, this is going to impact the right side of your brain. Okay, next, if you have a stroke on the right side of the brain, the left side of the body will be affected, usually producing, again, paralysis on the left side, sensory changes on the left side, vision problems, shifts in your spatial thinking or imagery, problems with thinking and memory, and quick inquisitive behavior style, okay? And in the brainstem, so if you have a stroke that occurs in the brainstem, it will likely affect both sides of the body, okay? This is the most severe damage. It's usually, or it can leave someone in what they call a locked-in state. So locked-in state is a condition where the person is generally unable to speak and they can't move because of the paralysis of muscles, but they can typically move their eyes vertically and they can blink, okay? So this person may remain conscious, they can hear, they can think, they can reason and comprehend, and they usually just communicate through eye movements, okay? So a brainstem stroke sounds like it would be kind of like your worst case scenario, okay? So what are some of the physical effects of stroke? Okay, now these are things that physical therapy can help with. We can get into that a little bit more when we start talking about the rehabilitation. But these are some physical effects. So there's something called spasticity or spasticity. This is a common post-stroke condition, and it really it causes stiff or rigid muscles. Okay, so when a muscle involuntarily contracts, when you move, it can commonly affect the elbow, the wrist, and the ankle. And so when a muscle can't complete its full range of motion, the surrounding tendons and soft tissue can become tight, okay? And that can make stressing the muscle a lot more difficult, as you can imagine, right? And if this is left untreated, it can also lead to joints in the arm and leg to be stuck or frozen in abnormal and possibly painful positions. Okay, and this is what we call contracture. All right. Next, foot drop. So this is common. Is a walking challenge caused by stroke. People with foot drop, what that means is they can't raise the front part of the foot. The weakness or paralysis of that muscle that normally lifts it prevents you from being able to move your foot. And so with the foot drop, there's that difficulty of clearing the foot while walking. And so that can lead to dragging or shuffling along the ground because your muscles are kind of paralyzed or weakened, so they can't lift your foot all the way to take that step. So your gait changes. Next, swallowing. Strokes can cause swallowing disorders called dysphagia. So if we don't identify and manage this, it can lead to poor nutrition, pneumonia, and disability. I think that's probably one of the more common effects of stroke that I've heard people talk about is not being able to swallow. So they have to like thicken everything and have to be very mindful on how they feed their loved ones. Aspiration is common for people who have dysphagia, right? So this occurs when something you swallowed, it enters the airway in the lungs. So it doesn't travel down into the stomach like it's supposed to. It's kind of like breathed into the lungs. And normally this, of course, is going to cause a violent cough, but in the case of stroke, it can reduce the sensation. So you might not even know that your loved one is experiencing aspiration. We call this silent aspiration because if you think about all those muscles are weakened or paralyzed, and so your loved one might not be able to cough. So they're just kind of silently in that space where there's fluid or what have you in their airway. Next is hemiparesis. Again, I apologize if I mispronounce these words. But this is a weakness or an inability to move on one side of the body. So this makes it hard to perform everyday activities like eating or getting dressed, right? Next, claw toe. Many survivors report that their toes begin to kind of curl under their feet post-stroke. As a consequence, of course, it's going to be kind of painful to walk because your toes are curled under and they're not supposed to be walked on, right? Muscles in the foot over contract, so they kind of clench. And this is due to that neurological abnormality. Because toe muscles are typically not very strong, the contracting muscle kind of overpowers the muscles in the toe and just tightens the tendons and causing joints of smaller toes to kind of buckle or curl in an unnatural way. So it's kind of like they're being pulled in, okay? Next thing that can be affected is fine motor skills. So fine motor skills, that's how we use our hands and coordinate the small muscles that control our fingers. And those skills, along with other arm functions like reaching or grasping, can be affected by stroke. And of course, the severity of the stroke will determine the extent of this weakness, okay? Stroke may also affect many upper extremity functions. So motor control, one's perception of where their body is in space, known as proprioception, decreased sensation, shoulder weakness, weakness in the wrist and hand, okay? Next, we have incontinence. So after a stroke, your loved one may develop incontinence. So this happens when the muscles that control, your bladder functioning and all that stuff, it's weakened. And so things aren't being held like they're supposed to be, right? The most common symptom is this unconscious kind of leaking that happens, but other types of bladder and bowel control problems may be present as well. And then the last one we're going to discuss is balance. So weakness can affect coordination of muscles that are needed to walk safely, right? So changes in thinking can affect judgment and lead to unsafe decisions, like maybe you're supposed to use a walker or a cane and you just don't do that anymore, right? And if you get hurt, you may end up hospitalized and admitted to a long-term care facility, okay? So if you have a stroke or if your loved one has a stroke, they may not be able to use their judgment very well and forget or neglect to use their recommended walking aids, and then they fall, and then that's a whole nother can of worms you have to deal with, right? So what are some other effects that aren't necessarily physical, but they can definitely come into play after a stroke? There's communication disorders that can come across after a stroke, like aphasia, apraxia, oral apraxia. These all may occur. And these can be difficult to distinguish because they can all kind of happen at the same time. So I'm going to go through them very quickly here. So aphasia is a difficulty using or understanding words. Okay, so this can obviously cause problems with understanding, finding the right words to use, reading or writing. Okay, so your loved one is still talking, but maybe they're using the wrong words, or you're speaking to them and they're not recognizing familiar words. Okay. Apraxia of speech is also known as verbal apraxia. This means that they're going to have difficulty initiating and performing the movements needed for speech. Okay, so this is going to impact just the way your tongue moves, right? The way that your jaw moves, how you form the words. Okay, so this can lead to problems in pronouncing sounds and maintaining the right rhythm and speed necessary for speech. Next, we have spatial neglect. So after a stroke, your loved one could lose awareness of things to one side of the body. This is what spatial neglect is. It's also called spatial inattention problems. And after stroke, it might be harder to detect than other changes, okay? One side neglect is more common with right brain stroke, meaning that your neglect will be on the left side. So what are the signs of spatial neglect? Maybe your loved one has trouble judging distances. So maybe they miss a table when they're putting down a glass, or they don't recognize the size of an object. They may have trouble understanding position in space, and the rate of movement may also be challenging. They may miss things placed on their affected side. So if they've got, if they have spatial neglect on their left side, they're not going to notice things as much as if it were placed on the other side, okay? They may overlook people or bump into things without realizing that they're there. Forget to put one arm into a shirt sleeve or dress only one side of the body. Maybe they only eat food on one side of their plate or only read one side of the book or of a page. And maybe they have trouble finding their way around the house because they only notice doors, buildings, or streets on one side, okay? You can only process sound coming from one side, okay? So it's almost like there's a division in how they are able to navigate and perceive the world, okay? Let's see. Looks like I got these kind of mixed up, but that's okay. Next one I'm going to go through is the pseudobulbar effect, or PBA. So people who have PBA have involuntary bouts of crying, laughter, or anger. These effects are uncontrollable and they can occur without emotional triggers, okay? So these are just kind of outbursts that are maybe disproportionate to something that's happening. So something that's slightly sad could cause exaggerated weeping. But on the flip side, something sad or somber might spur inappropriate laughter, okay? Again, these are things that they cannot control. It's just a side effect of a stroke. Or there could be rapid switching between laughing and crying, which of course can be kind of alarming for most of us. But when we understand that this is a part of a stroke or the results of a stroke, then we can be a bit more compassionate when that happens, right? Often there's this understanding that the response does not match the feeling, and the cause is a neurological disconnect between the brain's nerve connections or the chemistry that interferes with accurate emotional expressions, okay? The good thing is, though, that PBA can be treated. We just want to get an accurate diagnosis first and then talk to your healthcare professional about treatment options. And also educating other people in the space, other caregivers, respite providers, family members, to let them know, this is them not being rude. This isn't them being inappropriate. This is just part of where they are now, right? There may be some changes in personality and mood. After a stroke, they're very common. So things like impulsivity, apathy, that pseudobulbar effect we just talked about, anger, frustration, and even depression can affect a stroke survivor's quality of life, right? But of course, if you work with your healthcare team and other people in your space, these challenges can be overcome, okay? Very quickly, some other things. Memory loss is very common. Difficulty with concentrating all of a sudden, right? And stroke can also lead to vascular dementia. Some of you are caring for loved ones who have vascular dementia because they had a stroke, and now parts of the brain, regions of the brain, are now dying off, and that's leading to dementia. Okay. So how do we treat it? Okay. Rehabilitation and support of a survivor, the type that they get, can greatly influence their health outcome and their recovery. Okay. Too often I see people say, well, mom had a stroke, and they don't do any rehabilitation. They don't need treatment. They just deal with the aftermath. And sometimes that's unavoidable, and I understand that. But oftentimes, if you speak with the doctor, they will suggest some sort of treatment or rehabilitation to kind of get your loved one back to as close to what they were prior to the stroke as they can. Okay, and of course, depending on the intensity of the stroke and the lifestyle changes that happen afterward and all that, your new normal may look completely different. But it's always good to try and follow your doctor's directions as much as you can. Okay. Stroke affects so many different functions: paralysis and weakness, gross motor skills, fine motor skills, speech and language, cognition, vision, emotions. So appropriate quality rehabilitation with a strong team that's specially trained to meet those needs can improve the chances for the best possible recovery. Okay, but it's very important to know that the first 3 months after a stroke, the brain is very much like a brand new brain. So it's ready to learn. It's ready to make new connections, right? We need those neurons and those synapses kind of firing, right? And so this ability for our brains to adjust is what we call neuroplasticity. And it plays a really important role, a very vital role in our recovery. It takes about 3 months after the stroke for neuroplasticity to return to a more normal state. And after that, of course, the survivor can still work on regaining function and practice for improvement, but those improvements may come at a slower pace. Okay, so if your loved one has a stroke, we do not want to put rehabilitation on the back burner. We want to try to get in as quickly as possible so that we can get as ahead of the curve as we possibly can with their recovery. Okay, just a few more slides. So some tips for you as a caregiver. Okay, education is your greatest resource. All right. And like I said, all this information I got from the American Heart Association or the American Stroke Association. So these are all their expert tips, but I encourage you to go to that website yourself and dig around, because there's a lot of stuff on there that I wasn't able to put into these 10 or 12 slides here. But getting informational support, increasing your knowledge about what a stroke is and what to expect. Okay. This can help you feel more empowered, more in control, and less overwhelmed, which is what we all want for our caregiving journeys, right? We want to ask questions, right? What kind of stroke did my loved one have? What side of the brain did it affect? What caused the stroke? How does that affect my loved one's abilities? How can we prevent another stroke? If you remember earlier, a risk factor for strokes is a stroke, right? It increases your risk of having more than one. So ask your doctor about these things. Ask the primary, doctor on staff there that's dealing with your loved one, how can we prevent this going forward? And we want to make sure we're doing our own research from credible sources, right? Stroke can be beatable, and rehabilitation is key to achieving those victories along the way to recovery. Okay. Having a stroke does not have to be the end of the journey. Okay, there's a lot that we can still do, and we can recover after a stroke, but we have to make sure that we're educated and we know what the reality is for our loved one. Okay, so that we can be more concise with our care. Let's see. During this journey, of course, you will have to make a lot of decisions and serve as an advocate for your loved one. Okay. So we want to make sure that we're finding support from other people, right? Reach out to family and friends. Tell them what you're experiencing. Having them reach out with phone calls, emails, or just having shared time together. That can go a long way to help you feel supported and rejuvenated. Okay. Especially if there's, I've talked to several caregivers where, their loved one was already experiencing dementia, let's say, for example, and then a stroke happens. And so then they have a whole new set of things that they now have to manage and provide care for their loved one. And so it's compounding already a stressful situation. So we want to make sure that we are still reaching out to our support networks. We are still getting that respite that we need, so that way we can track this next leg of the journey as well equipped as we can, right? And again, oh, and I just noticed there is a typo there. Let me fix that real quick because it's going to drive me nuts if I don't. There we go. Taking time for yourself. Remember, caring for yourself is caring for your loved one. Okay, so yes, your loved one has a lot of things that they need prioritized, but those priorities will not be met if you do not take care of yourself. Okay, so the number one priority is to make sure that you are available and around and healthy enough to manage the care of another person. Okay. So some resources. Okay. There is something called the Stroke Family Warm Line. So a warm line is not the same as a hotline. Hotline is usually like emergency situations, right? Like a 988, like a suicide hotline, things like that. A warm line is going to have, it's not usually not going to be a 24/7 thing, and it's usually not an emergency situation. They'll always tell you to call, call 911 if there is an emergency. But the Stroke Family Warm Line, this connects stroke survivors, their families, and caregivers with an American Stroke Association team member who can provide support, information, or just a listening ear. Okay, so there are the times that you can call them: 8:30 to 5 p.m. Central Time, Monday through Friday, at 1-888-4 Okay. Next, there's a stroke support group finder. Sorry, a stroke support group finder. The way I said that, the cadence made it sound so strange. I apologize. So you can go to this website, and this is how you can meet people who are on the same path as you, right? Benefit from their wisdom, share your own, explore how to make your experiences smoother and easier to manage. We learn so much in community with one another. Of course, websites and doctors' offices are a great resource, but lived experience, I think, is invaluable. And so we don't want to isolate. We want to make sure we reach out to people who understand where we're coming from and where we are. And then, of course, there is the support network, .heart.org. And this is just to give you local resources for managing stroke aftercare. Okay. So here's my contact info. If you want to reach out to me, I don't work Wednesdays. So if you call or send me an email and I don't respond right away, it's because I'm not there. So you can reach out to me if you need some support, if you need some additional resources. If you're interested in getting information about our respite reimbursement program through Alabama Lifespan Respite, I'm more than happy to give you that information. Or you can just go to our website, alabamarespite.org, and that's all there for you as well. Okay. And that's also where you'll find all of my recorded trainings as well. So if you want to watch this again, you can go there and it'll connect you to the YouTube channel. Okay.